Hey everybody, happy Sunday. It's Caleb again. So today's question or topic is how to transition medically and precautions to take. Um, so my first venture into medical transition was starting on hormones. I take testosterone. I take a 100 milligram injection in my thigh every 2 weeks. It's the same dose I've been on for the last couple of years. The importance with taking hormones, go through a medical provider. Find a medical provider that you trust, that is aware of transgender issues. I'm really blessed to have care through the Veterans Administration, and I have an endocrinologist who's incredibly savvy about transgender in general. She's prescribed to trans men and trans women hormone treatments, and just is really aware, very awake and aware of the situation, and yeah. So anyway, so for some of the requirements that I've encountered was I had to get genetic testing. I had to have I still have to have blood tests. My endocrinologist requires every 6 months now blood tests to monitor how I'm doing. And it's not just for hormones, it's for cholesterol levels. It's, I get my blood pressure checked, which is not a blood test, but, that sort of thing. So there's that. Learn how to give yourself an injection if you're taking the injectable. There's reasons why, like testosterone, for example, has to be given in a muscle. So if you are prescribed injectable testosterone, for example, or I have heard of trans women that their hormones can also be injectable. I believe that those also have to be intramuscular. So I was already a medical assistant, so I've been giving injections for years. So I already kind of knew how to go about an intramuscular injection. I knew the safe way to do it. Don't reuse your needles, even if you're using it on yourself. Don't do it. And I use a different needle to draw up my testosterone into the syringe. I use a larger gauge. The smaller the number, the larger the hole in the needle. So I use a 16 gauge to draw up my testosterone, and I reuse that one because it just goes through the plunger in the rubber stopper in the bottle. But I take that off, and I always use a fresh 22 gauge 1.5-inch needle to inject with. The reason that I don't inject with the same needle is because when I push that needle into my skin and into the muscle, it dulls the needle a little bit. So repeated uses, one, it causes pain, but two, instead of being a nice slice down into the skin and muscle, it actually begins tearing, which will open me up for infection. Also, wash your hands before drawing up and injecting. Proper hand washing technique is a good idea anyway. Get alcohol pads. Clean the top of the bottle off before you draw up. Clean the site of your skin in a circular fashion before injecting into the muscle. That kind of thing. Your provider that prescribes your testosterone, should ask you if you've ever given an intramuscular injection to yourself or to anybody. And even if you have, they need to offer a tutorial on how to give yourself an intramuscular injection. I believe that they should have a medical professional, a nurse, a medical assistant, a provider of some sort, somebody watch you do it so that they can talk to you about your technique and make sure that you're doing it safely. Also, alternate your sites. And what I mean by that is, I inject in, one thigh one time, and then the next injection I inject in the other thigh. I just alternate back and forth. That's just to reduce damage to the area, and that's with any medication. That doesn't really have anything to do with hormones specifically. That's with any injectable medication. You should always alternate your site. As far as I've also had top surgery. I shopped around. I wasn't. I was picky. I needed to know that one, my surgeon had performed successful top surgeries for trans men, so I required that I saw pictures of work that they had done. And I didn't want just like one or two. I also required that they had formal training outside of being a plastic surgeon. I also need to know that they had formal training specifically for transmasculine, in my case, top surgery. Um, and then experience. The surgeon I found eventually that I went to had, I think, like a decade, almost a decade of doing transmasculine top surgery. I was very happy with his work. Make sure if you are going to have top surgery, and I can only come from the place of being a trans man who's had top surgery. I don't really know. I suppose it would be similar for a trans woman who may be having chest augmentation. I don't know if it's the same precautions, but as a trans man, I'm grateful that I had a trans brother in town who'd had top surgery, and he gave me some pointers that my surgeon and surgical team didn't necessarily think or know to tell me. So some of the precautions that he gave me a heads up on is before surgery, make sure that I put everything I use regularly down at chest level so that I'm not reaching above my head. Make sure that I stock up on fluids, not soda pop or coffee, but like Gatorade, water, that kind of thing to aid in the healing process. Make sure that I get my medications filled, my pain control medications filled prior to having surgery, or make sure that I have a friend who's willing and able to get that for me so that it's already there when I come home. And I did all those things, and it really helped. Also, I came home with drains. Not everybody comes home with drains, but I did, and I knew I was going to. So I had already stocked up on shirts with a pocket on each side so I could put the drains in it. That was really helpful for that week. I also got a pillow, one of those prop-up pillows with like the arms, looked like a seat cushion. And that was nice because it gave my arms a break after surgery. I could lean back and just rest my arms on something. And then for me, I guess a personal precaution for me, I'm a recovering addict. So knowing that I would be taking narcotic pain medication, my dogs are going wild on the bed. Knowing that I would be taking narcotic pain medication, for me, a precaution I needed to take was the friend of mine that let me stay at her house while I was recovering that first week with drains. She kept the pain medication just because I was a drug seeker when I was in active addiction. So the medication I was given to control my pain after surgery was exactly the medication I abused for well over a decade. So for me, I just really needed to be conscious and aware of what I was doing. So she would ask me every 4 to 6 hours, "How's your pain?" And it was up to me to be honest. And she would, give me either a half a medication, half a Percocet, or a full one. But I needed to have that dialogue with her before I had surgery to let her know, hey, don't offer me, for me personally, this is my precaution that I needed to take as a recovering addict. Don't just offer me a full Percocet every 4 to 6 hours. Ask me my pain level, and then offer me a half if it's, for me it was, if it's 5 or below. The importance of taking my pain medications as scheduled within the first week after surgery, from a medical perspective, being a medical assistant, I can say that my pain was well controlled because I took the medication as directed. If I had skipped a dose because my pain level didn't seem to be bad, the reason it wasn't bad is because I was taking the pain medication. So it would have gotten out of control, and that would have put me at risk for a lot of problems. And then the common stuff of, follow your provider's orders after surgery for, a proper washing of the site, um, changing gauze, measuring output, keep a log of time that your narcotics are taken and how often you're taking them, and also your intake and output. And they'll go over all of that at the surgical appointment if you choose to take that route. Um, and then keep close to your support group for whatever that means. For me, it also meant keeping close to my recovery support group as far as addiction goes. So this has been a little bit of a long video, but so far that's what I've encountered and experienced through medical transition. I'm looking forward to bottom surgery in about 5 years. I hope. I'm working on losing weight and getting healthier, and then I'll start looking at bottom surgeons. So I don't have any actual experience on recovering from that yet. I hope to have experience to share in the future. Thanks. And also, if you are interested in being a paperboy, doing what I've just done, sharing your experience, um, let me know. Drop me a note, subscribe. There's a subscribe button. I'll get you contacted with Ty, who can get you in the loop to start doing these videos if you wish. Thanks. Happy Sunday. Have a great day. Bye.